In this video, we can discuss about antiviral drugs. From the word itself, we can understand these are the drugs which are used against the viral infections. Here, we will discuss the definition, classification, mechanism of action, adverse drug reaction and uses of some important classes of antiviral drugs. So before jumping to the classification and mechanism of antiviral drugs, we have to understand some basic knowledge about virus. As we know, virus is an obligative parasite. What is meant by obligative parasite? Virus cannot be grown in any atmosphere other than a living tissue, whether it may be plant tissue or it may be animal tissue. Anyhow, it requires a host cell for their multiplication and for their life. That's why these are known as obligative parasites. And usually virus have two life cycle, lytic cycle and lysogenic cycle. As the name indicates, in lytic cycle, this virus will transmit to next cell after killing their first host cell. That is meant by lytic. They will lyse the host cell after their maturation before release. And in case of lysogenic cycle, they will live in host cell up to a period without lysing the host cell. So these are the basic steps of lytic cycle. First of all, virus will come and in contact with the cell, and this step is known as attachment. So after this attachment, virus will inject their genetic material, it may be DNA or RNA, into the host cell, and that step is known as penetration. And the protein coat will be remain outside the host cell, only genetic material will be injected into the host cell. So after entering the genetic material of the virus into host cell, this viral genetic material will take over all the function of the host cell. So by using the machineries and different proteins and enzymes of the host cell, virus genetic material will produce their required proteins and structurals for their growth. So after producing or synthesizing nucleic acid and proteins which are required for the viral replication, they will assemble and package inside the host cell. So after the assembly and package, this virus will be released outside to attack another host cell. So this is the basic life cycle, and this life cycle is very important for the understanding of mechanism of action of antiviral drugs. So these are the basic steps. The first step is attachment. The virus will come in contact with the host cell, and this step can be prevented by different drugs like enzyme fusion inhibitors like enfuratides. Okay, so after attachment, virus will inject their genetic material into the host cell. So there will be an uncoating, and this viral RNA or DNA will be converted into viral DNA inside the host cell by using different reverse transcriptase enzyme. So these steps can be prevented by different antiviral drugs like nucleoside reverse transcriptase inhibitors or non-nucleoside reverse transcriptase inhibitors. So after viral DNA after converting viral RNA into viral DNA in the host cell, this viral DNA will integrate with the DNA host cell and it will transcript to viral mRNA. After that, they will translate to produce viral proteins, and these viral proteins will assemble and they will maturate. So this stage can be prevented by an enzyme or by using drugs protease inhibitors. So these are the different mechanism of action of viral drugs. Okay, Now coming to the classification of viral drugs, it can be mainly classified into non-retroviral antiviral drugs and antiretroviral drugs. So examples of non-retroviral drugs are anti-herpes virus drugs like idoxuridine, trifluridine, acyclovir, valcyclovir, famciclovir, ganciclovir, valganciclovir, cidofovir, foscarnet, fomivicerin. Then anti-influenza drugs like amantadine, rimantadine, oslamavir, zanamivir. Now anti-herpes non-selective antiviral drugs like for hepatitis B, lamivudine, adifovir dipivoxil and tenofovir, and for hepatitis C, ribavirin and interferon alpha. Now examples for antiretroviral drug which is used against the retrovirus, it may be either nucleoside reverse transcriptase inhibitors like zidovudine, didenosine, stavudine, lamivudine, abacavir and emtricitabine and tenofovir, and non-nucleoside reverse transcriptase inhibitors like nevirapine, efavirenz and dilaviridins, then protease inhibitors like ritonavir, atsanavir, indanavir, nelfinavir, saquinavir, aprinavir and lopinavir, then entry inhibitors like enfuvirtide, then CCR5 receptor inhibitors like maraviroc, then integrase inhibitors raltegravir. So these are the classification of antiviral drugs. There are non-retroviral drugs as well as antiretroviral drugs. So this is the classification of antiviral drugs. Now coming to the first antiviral drug, that is acyclovir. This acyclovir will act by a mechanism of its active form in infected cell will inhibit their viral DNA synthesis and its replication by inhibiting an enzyme thymidine kinase. So in acyclovir, herpes specific thymidine kinase will convert this acyclovir to acyclovir monophosphate, and cellular kinase will convert acyclovir monophosphate to acyclovir triphosphate, and this acyclovir triphosphate will inhibit herpes virus DNA polymerase competitively, and also this acyclovir triphosphate will get incorporated in the viral DNA and stop the lengthening of DNA strand. Then it will terminate the DNA, inhibit the DNA polymerase reversibly. So that is the mechanism of action of acyclovir. Now coming to the adverse drug reactions of acyclovir, it will produce different adverse reaction on different route of administration. On topical administration, it will produce stinging and burning sensation after each application. On oral administration, usually the drug is well tolerated, but sometimes it may produce headache, nausea, malaise and some CNS effect. On intravenous administration, it may produce rashes, sweating, emesis and falling BP. And in dose dependent manner, it will decreases glomerular filtration rate, and it will produce reversible neurological manifestation like tremor, lethargy, disorientation, hallucination, convulsions and coma to higher doses. So these are the adverse drug reactions. Now these are mainly used for the treatment of different viral infection which are caused by different herpes virus, like this is used against genital herpes simplex, mucocutaneous herpes simplex, herpes simplex encephalitis, herpes simplex keratitis, herpes zoster and chickenpox. Now another important antiviral drug is foscarnet, and this will inhibit the herpes virus by inhibiting DNA polymerase enzyme as well as reverse transcriptase enzyme. And the important adverse drug reactions are, it may damage kidney and it may produce renal diabetic like condition, Acute renal failure also can occur. Also, it may produce anemia, phlebitis, or this is the inflammation of the vein, tremor, convulsion, and other neurological as well as constitutional symptoms due to hypokalemia are frequent. Now, uses of foscarnet. It is mainly used for the treatment of cytomegalovirus retinitis and other cytomegalovirus infections in AIDS patients. Also, it can be used in acyclovir-resistant mucocutaneous herpes simplex type 2 and varicella zoster infection in AIDS patients. So, these are the uses of foscarnet. Now, coming to the next drug, that is amantadine, which is a drug for influenza virus, and they will act by inhibiting the replication of influenza A virus. Usually it appears to act at the early stage, possibly on uncoating stage of viral replication, as well as the late step in viral assembly in the viral replication stage. So amantadine will act at both stage of uncoating as well as assembly stage. A protein designated M2 which act as an ion channel has been identified one of its target action of amantadine. So that is the mechanism of action of amantadine. Now coming to the adverse drug reaction, amantadine may cause nausea, anorexia, insomnia, dizziness, nightmares, lack of mental concentration, and rarely hallucination. And angular edema can occur due to the local constriction. So these are the adverse drug reactions of amantadine, and it is contraindicated in epilepsy and other CNS diseases, as well as gastric ulcer, as well as in pregnant women. So it should be avoided in this kind of patients. And it is mainly used for the prophylaxis of influenza A2 virus, treatment of influenzaal illness, and also it is used for the Parkinsonism, treatment of Parkinsonism. Now, next drug which is used against the retroviral drug, or next classification is nucleoside reverse transcriptase inhibitors, or NRTIs, like zidovudine. This zidovudine is a thymidine analogs, and they will act by a mechanism of inhibiting reverse transcriptase enzyme. This enzyme is responsible for the conversion of single stranded RNA into double stranded DNA in the virus. So that is the zidovudine will act by inhibiting an enzyme reverse transcriptase. That's why it is known as nucleoside reverse transcriptase inhibitors. Now coming to the adverse drug reaction, it will produce different adverse drug reactions like anemia, neutropenia, nausea, anorexia, abdominal pain, headache, insomnia, and myalgia. And also it may cause different area like myopathy, pigmentation of nail, lactic acidosis, hematomegaly, convulsion, and encephalopathy are frequent. Coming to the drug interaction, nucleoside reverse transcriptase inhibitor like zidovudine will increases the paracetamol toxicity. It will increases the antifungal toxicity. Azo-antifungal toxicity will increases the toxicity of zidovudine, and nephrotoxic as well as myelosuppressive drugs and probenecid will increases their toxicity. And this zidovudine, or nucleoside reverse transcriptase inhibitors, is mainly used in HIV infected patient only in combination with other two antiviral drugs. So that is the uses of nucleoside reverse transcriptase inhibitors like zidovudine. So this is the stage of action of NRTIs and NNRTIs, nucleoside reverse transcriptase inhibitors, and non-nucleoside reverse transcriptase inhibitors will act on reverse transcriptase enzyme, which is responsible for the conversion of viral single-stranded RNA into viral double-stranded DNA. So by inhibiting this, all the process can be inhibited and we can kill the virus. So that is the mechanism of action of nucleoside reverse transcriptase inhibitors and non-nucleoside reverse transcriptase inhibitor. Now the difference between nucleoside reverse transcriptase inhibitors and non-nucleoside reverse transcriptase inhibitor is, in nucleoside reverse transcriptase inhibitors, these binding will be in competitive manner in which these are structurally similar to the natural purine and pyrimidine molecules. But non-nucleoside reverse transcriptase inhibitors are nucleoside unrelated compound which will directly inhibit reverse transcriptase enzyme. Thereby it will inhibit the conversion of viral RNA into viral DNA. So that is the mechanism of action of non-nucleoside reverse transcriptase inhibitors like nevirapine and efavirenz. Now coming to the adverse drug reactions of non-nucleoside reverse transcriptase inhibitors like nevirapine and efavirenz. Nevirapine will causes different areas like rashes, which are most commonest adverse drug reaction, which is followed by nausea and headache. Occasionally some skin reactions may occur which are severe, and fever, rise in transaminase enzyme occur dose dependent manner, and this nevirapine is an potentially hepatotoxic drugs. Now efavirenz will causes rashes, dizziness, insomnia and variety of neuropsychiatric symptoms. So these are the adverse drug reactions of non-nucleoside reverse transcriptase inhibitors. Now next class of antiviral drug is protease inhibitors like sacubitril and indinavir. Now coming to the mechanism of action, these drugs, protease inhibitors, will inhibit a protease enzyme which is an essential enzyme which is required for the conversion of polyprotein to various functional proteins. So by inhibiting protease enzyme, we can prevent the viral maturation and assembly stage. So this is the stage of action of antiviral drugs like protease inhibitors. It will affect on the viral assembly and viral maturation stage. Now coming to the adverse drug reactions of sacubitril and indinavir: Stephen-Johnson syndrome, hyperlipidemia, gastrointestinal intolerance, asthenia, headache, dizziness, limb and facial tingling, and numbness and rashes, and lipidotrophy, that is the abdominal obesity or buffalo hump with the wasting of limbs and faces. Then dyslipidemia due to raised triglycerides and cholesterol, which may necessitate hypolipidemic drugs, and insulin resistance. Diabetic may be exacerbated. So these are the important adverse drug reactions of protease inhibitors like sacubitril and indinavir. Viral drug is fusion inhibitors like enfuvirtides. Now coming to the mechanism of action of fusion inhibitors, these drugs enfuvirtide will act by binding to the HIV-1 envelope transmembrane glycoprotein, which is involved in the fusion of viral and cellular membrane. Thereby binding with this transmembrane glycoprotein, fusion of two membrane is thus prevented, and thereby the entry of virus into the cell is blocked. So rest of the action will be prevented. So here this is the first stage, attachment and fusion. So this drug like enfuvirtide will act on this glycoproteins, thereby it will prevent this fusion, and thereby it will prevent the injection of viral genetic material into the cell, and the following process will be inhibited. So that is the next class of drug, fusion inhibitor, enfuvirtide mechanism of action. Now coming to other antiviral drugs like non-selective antiviral drugs like adifovir dipivoxil. These will act by phosphorylated to diphosphate which have high affinity for HBV DNA polymerase. compared to the host cell DNA polymerase, this enzyme is inhibited and adenoadifovir itself get incorporated into viral DNA, resulting into the termination of DNA chain. Now, important adverse drug reactions of adifovir dipivoxils are sore throat, headache, weakness, abdominal pain and flu syndrome. Nephrotoxicity occur at higher doses and those in pre-existing renal insufficiency. Lactic acidosis is a risk in patients receiving anti-HIV drugs. And this is mainly used for the treatment of chronic hepatitis B, including lamivudine resistant cases and thus having concurrent HIV infections and those having concurrent HIV infections. So these are the uses of non-selective antiviral drugs like adifovir dipivoxil. Now another important antiviral drug is oseltamivir and zanamivir, which are used for the treatment of avian flu or swine flu, H1N1 type of flu. And important ADR are nausea, abdominal pain due to gastric irritation, headache, weakness, sadness, diarrhea, cough and insomnia, and skin rashes, skin reactions. And this oseltamivir and zanamivir are used for the treatment of influenza A, H5N1 or bird flu, and H1N1 or swine flu strains and influenza B viruses. So these are the uses of oseltamivir and zanamivir. So that is all about the definition, classification, mechanism of action, ADR and uses of some important classes of antiviral drugs. Hope it is clear. Thank you for watching this video.